And the very first one, which is probably the most important one, is the sustained positivity rate of less than 10%, trending towards 5% for a certain period of time. And the medical experts all agree that that would be 14 days. So what that means is a positivity rate, and positivity rate, I know you know, is the percent of individuals tested who are COVID-19 positive. Right now, the county has fluctuated anywhere between 22%, 29%. Yesterday we were slightly over 30%. But it is amazing that a month ago, exactly 1 month ago, we were at 6%. And something happened in our community. I think individuals decided not to follow the recommendations of government, to not necessarily wear their masks, to congregate publicly, to not maintain social distance. And when you breach the recommendation, then we see what we're seeing today, which is an escalation of positivity. There is no research study, no recommendation internationally, nationally, in the state or here locally that recommends the physical opening of schools when the threshold of positivity or the rate of positivity is what it is now. The second recommendation is a steady reduction in the number of individuals hospitalized for COVID-19 or flu-like symptoms for 14 days. Again, that 14-day time frame continues to recur. The third one is a sustained reduction in ICU bed occupancy due to COVID-19, also for 14 days. And these are data elements acknowledged by not only the medical community, but also the public health community. Next one, this was really a critical issue that received much discussion, is a continuous reduced community viral burden. And that means a total number of virus-positive individuals, again, for 14 days. The fifth metric or criteria is an increase in COVID-19 specific viral test availability with a decreased wait time to receive the test. All of the medical experts, whether we're talking about Dr. Marty, Dr. Schechter, Dr. Murthy, across the board, they said, you may have the best plans in place, you may be tracking the data very well, but if it takes a long time for an individual to be able to be tested, and then it takes an equally long time for the tests to be returned, and we know that right now some tests are being returned within a week, 10 days, then your effectiveness at actually containing a case, if a case is declared through contact tracing, is compromised. So this was a really important recommendation. The sixth one is a decreased response time for test results to less than 48 hours in time, as I mentioned earlier. The seventh one is an increase in the quantity and quality of contact tracing that provides prompt and needed input to decision makers. Now, we have a protocol in place for contact tracing. I know the mayor, this has been a huge concern for Mayor Jimenez, where he has actually declared this as a top priority, not on getting the resources, but actually to have the health department and other entities put the people on the ground that can accomplish this. We will not have an army of contact tracers in Miami-Dade County Public Schools. That means that the same individuals that perform these types of health investigations in a community are the ones who will do it for our school system. And we know that schools have the potential of being a petri dish for contamination. So if there isn't this real increase in quantity and quality of contact tracing in our community, it will make our reopening that much more difficult. And then last, an increased number of general vaccinations for school-age children that really meets the goals of herd immunity in our community. This is a phenomenon that we have seen. Because of the pandemic, a lot of parents who ordinarily would have taken their children for their regular immunization have not done so. Now we have a huge campaign, a media campaign, awareness campaign for the parents to get them to get their vaccinations done. Critically important.